Herniated discs. If you have had a herniated disc into your neck or lower back, then you do understand that this is something that is extremely painful. A herniated disc in the lower back, for example, this is a gelatinous center that is encompassed by a thick tissue, and it's surrounded by two joints. And when the gelatinous center can rip through that tissue and put pressure on a spinal nerve or the spinal cord, it's called a herniated disc, and it is extremely painful, and it can travel into the groin, into the cheek, into the leg, and travel down into the foot. It can cause a patient to experience pain in multiple positions, and oftentimes does get relief when lying supine or on the back. And patients have a difficult time sleeping and moving and walking, and it's something that has been oftentimes treated through either injection therapy or through surgery. Now there is a component that we have in the office and in many chiropractic offices called non-surgical spinal decompression. It is extremely effective when treating a patient who has this condition. It is not the win-all only thing to do. It can help to effectively treat the herniated disc, but it must be encompassed through traditional rehab and physical therapy to help to strengthen and stabilize the now healed disc condition. So first, we take a patient and place them on this unit onto the machine. And the unit, what it will do is help to effectively reduce the pressure that's laid within the disc via increasing the volume of the disc and then dropping the pressure within it. When that happens, it acts like a suction cup and will help to suck in fluid and interstitial fluid inside of the disc and help to reduce the herniation. As the herniation is reduced over time, the ligament tissue that surrounds the spine will also begin to heal and to support the spinal joints. Over time, now traditionally this therapy is provided anywhere from 20 to 35 times to a patient over a period of 2 or 3 months. And during that process, a patient is trained on how to provide themselves with decompressive home exercises, and then will be eventually trained from passive ranges of motion into active and resistive ranges of motion, which means beginning to use weights and contracting muscles that will help to strengthen the core and will over time begin to heal a herniated disc and stabilize it as well. This is how a patient will achieve true health and avoid surgical procedures more than 80% of the time in the office. Spinal decompression through surgery is typically called a laminectomy. This is non-surgical spinal decompression and requires no surgery, no cutting, extremely effective.